Coming up in the morning edition, a field hospital set up to continue fight against COVID-19. Also,
in many areas of Pinewood, they had up to 18 inches, and in some areas up to 2 feet of water.
Flooding woes continue in the Pinewood community, and
we have almost 24 members of the instructional staff have already expressed interest and have become a part of UTEP.
BTVI instructors seeking to become unionized. Those stories and more when the morning edition comes right back.
During this pandemic, it is our duty to ensure that all citizens, residents, and visitors are adhering to the COVID-19 safety protocol. Restaurants may operate utilizing curbside pickup, drive-through, takeaway, or delivery. Any establishment who allows the entry of any person not wearing a mask is liable upon a summary conviction to a fine of $500. I am Ambassador Ashanti Ruko of the COVID-19 Enforcement Unit. Save a life that may be your own.
This message brought to you by the Ministry of National Security in conjunction with the Broadcasting Corporation of the Bahamas.
ZNS is everywhere you are when you download the new ZNS app. Watch our live channel to keep up with what's going on in the nation. News updates, we've got you covered. Tune into our radio stations with just a swipe. On the road, on the go, we're here with you. Available for download on the App Store and the Google Play Store.
Good morning, everyone. I'm LaDawn Davis. Thanks so much for tuning in. With COVID cases and deaths climbing, a makeshift hospital near the country's premier healthcare facility is set to receive patients as early as today. This as the strain on the country's healthcare system continues to grow due to the COVID-19 pandemic. Lloyd Allen is live outside the Princess Margaret Hospital with the latest. Good morning, Lloyd.
Yes, good morning, LaDawn, and good morning, Bahamas. In a matter of 3 days, the Samaritan Purse International Relief Organization has set up operation here in the Bahamas to assist in local fights against COVID-19. Helping us to understand this effort is Dr. Elliot Tenpenny from the organization. Good morning, Mr. Tenpenny. And talk to us about how your setup was initially for this operation.
Absolutely. We were invited last week by the Prime Minister to come here and help with the fight against COVID-19. We arrived on Thursday, began setting up on Friday, and expect to see patients today.
Now, I understand that you have about 30 staff members here, a part of your resources to assist doctors and other staff members as well.
Absolutely. We have about 30 to 40 staff members here. That includes electrical engineers, biomedical technicians, but also doctors, nurses, and Samaritan's Purse in general has about 100 staff here on the islands and an office since the work we've done last year in Grand Bahama, and about 80% of those are local Bahamian staff.
Now, obviously, this effort takes a lot of manpower, and you're in dialogue as well with the members of the Princess Margaret Hospital as well.
Yeah, absolutely. They've been integral partners in this. We couldn't have done it without them. This facility is not a standalone hospital. This facility is in full partnership and integration with the local Princess Margaret Hospital.
So when it comes to specific needs from the hospital, is there anything that you need, or do you completely operate as a standalone facility?
So we do rely on them for electrical and water and things like that. We've brought supplies. We've brought nurses. The big thing with Samaritan's Purse is we don't want to cause a burden on the local healthcare system that's already been struggling fighting this epidemic over the last many months.
And I know that yourself, you've worked with the COVID fight in New York as well. Talk to us about what's similar there and here. I spoke with one of your staff members earlier who talked about a spike in cases that would have invited you into places like that. But are there any similarities between what you've worked on in New York compared to here in the Bahamas?
Yeah, absolutely. There's a lot of similarities. The amount of cases are climbing. I mean, they have to say that bluntly. The hospitals are overwhelmed here, and that's why they've invited us in. The setup of this unit and the infection prevention model and what we do was developed right there in New York and in Italy prior to that with Samaritan's Purse deployments to be able to take care of a highly infectious disease in a safe way.
And You used the word just now that reminds me, very important in this fight against COVID-19. It comes to the experiences of those medical staff members. You yourself come from a background in emergency medicine, but your team members, what background do they come with as well?
So we have experts in critical care, cardiology. We have experts in multiple medical specialties, nurses that from emergency medicine, inpatient medicine, ICU care, a lot of different specialties medically.
And during your setup over the weekend as well, there were some factors. Obviously, we had a lot of rain over the weekend, some wind as well. Did that impact your operations?
A little bit. It made us cognizant of being very careful and making sure that we have everything tied down, secured, especially with the wind. The rain wasn't bad, and we were glad to have a reprieve from the heat and the sun. So.
Now, obviously, around the world, COVID-19, we're not sure when the end is. Some people are still looking for the end in sight. How long are you committed to being in town and assisting with efforts here?
So we're doing a couple of different things, setting up this unit and then working with Princess Margaret Hospital on infection prevention measures within the hospital, helping them align and work on all the things that they have in the hospital to hopefully take care of more patients. We'll be here. We're looking at 4 to 6 weeks here, and then hopefully handing this over to continue to be used by Princess Margaret Hospital.
And very important, bedding capacity. How many patients can you actually see here on this site?
Sure. Here at this site, we'll have 28 patients that will be transferred from Princess Margaret Hospital. And all patients still enter the hospital the same way, through the emergency department, through admissions, and they'll transfer them here.
Okay. All right. And I know over the past there's been issues with, some family members complaining, and this is around the world, complaining of not being able to see their loved ones during that time. Is that an option here? Have you set up virtual options?
Well, phones, virtual options are the best we can do. Whenever there's a sick patient, unfortunately, you have to be very careful not to infect the rest of their family. And that's a tough balance because, yes, the families need to see their family, but they also need to not get sick. And so we're following, again, Princess Margaret's Hospital's policies and that kind of thing to lead us in that.
Well, Dr. Tenpenny, thank you so much for speaking with us. Hopefully, I will not be seeing you anytime soon. Reporting here from Princess Margaret Hospital for the morning edition, Lloyd Allen, ZNS Network News.
Thanks a lot, Lloyd. Well, still on health, while COVID-19 testing numbers are up significantly, Chief Medical Officer Dr. Pearl McMillan says health officials are still having issues, especially for the turnaround time for results.
When we look at our laboratory situation, we continue to have challenges with reporting of laboratory results within the agreed 48-hour time frame. We are working closely with all labs on a daily basis, and some progress is being made. Contact tracing cannot begin without knowing who the positive cases are, and without receipt of the key information used to initiate the contact tracing.
McMillan added that COVID numbers that come as a result of the delay may not reflect reality.
In recent days, the ministry has reported large numbers of new COVID cases. For example, and many of us may recall, on the 14th of October, almost 200 cases were reflected in our daily release. Although October 14 was the date the results were shared with the surveillance team from the various lab facilities, it was not the date the result was processed by the lab, nor was it necessarily the date when the persons were swabbed.
Health officials also responding to claims made by former Minister of Health Dr. Dwayne Sands, who indicated that healthcare professionals are currently being tasked with the tough decision of deciding which patient lives or dies due to the overburdened healthcare system.
Now, I will give you my experience offering care within one of these facilities that has been challenging. On at least one of the nights that I was on call, we did have a patient present to the emergency room, and we did not have the suitable room to manage that patient. And what we had to do was shift patients around, more stable patients, so that we could offer that patient this kind of oxygen and respiratory support that patient needed. I can't speak for the other facilities, but I can tell you that the reality of the situation when facilities are beyond capacity is that you could be in a situation where you could not manage the patient and you might not be able to care for a patient that needs respiratory support.
What is a twindemic? Well, it's the newest term coined by health officials worldwide as a threat of a severe flu outbreak amid the COVID-19 pandemic. Anthony Smith has more.
What happens when two very big but deadly contagious viruses meet? Well, that is a question that has been put to the biggest of researchers and healthcare practitioners, many of whom are pondering what the impending flu season will mean as the world continues to battle a global pandemic, some calling the overlapping of the two the 2020 twindemic. According to the World Health Organization, influenza kills between 300,000 and 650,000 persons each year, a number stark in comparison to the already 1 million dead globally due to COVID-19. However, a number when combined together could also be a recipe for disaster, and here's why. An overwhelmed healthcare system aside, both respiratory illnesses remarkably share the same symptoms, stunning similarities that healthcare professionals say should be taken seriously, as early studies from researchers at the University of Arizona have determined that it is indeed possible to contract both at the same time. Their suggestion, more COVID-19 testing, in addition to wearing masks and following health safety guidelines, is for persons also not to skip out on getting their flu shot. But with a generally low vaccine uptake rate, there's no saying on how this could possibly impact persons in the Bahamas. Now, according to global outlets, the United States has just recorded its first 2020 flu season-related death, a morbid but strong warning to take all precautions in avoiding the spread of a possible twindemic. Anthony Smith, ZNS Network News.
There are lingering concerns about the health of police officers in a COVID environment, with several officers testing positive and placed in quarantine. Commissioner of Police Paul Rolle gave an update on the COVID numbers impacting the force.
Last week when I reported to the nation, it was 165. And since then, I believe we may have gotten, I know we got a few more, but I don't have an exact number. Couldn't have been more than maybe 15 or 20.
Police Commissioner also addressed the issue of manpower on the force.
We are in a period, specifically in the force, where we have a number of officers that are retiring. That is the main thing. But of course, whenever an officer is tested positive or is suspected to have been into contact with someone that is positive, we ask them to isolate themselves, and but we still have the numbers. Because when it's like that from the stations, then I pull from other areas that are not frontline. So it's not at a critical stage at all, no.
As the country prepares to reopen its tourism market in just a matter of weeks, much concern has been raised about flattening the curve. This is what Health Minister, the Honorable Renwood Wells, had to say on the matter.
In seeking to be responsive to the needs of the Bahamian people, are seeing how it is that we can best both manage the survivability of our economic life as well as the physical life and livelihood of the Bahamian people. And so, whereas we are receiving advice as to what needs to take place within the health sphere, we're also taking all of that into consideration in the decision-making process. Obviously, as a government, we're never going to do anything that's going to overtly endanger the lives of our people. But we do believe that we are on to a model, a formula that can work.
Additionally, Wells says the Bahamas is not alone in trying to find a solution to this vexing issue.
In Europe, just last week, they had over 700,000 COVID positive cases, 100,000 COVID positive cases a day. And you would see that nations such as France has instituted what we are now doing, a curfew from like 7 p.m. to 5 p.m. You'd find like the Netherlands are restricting the amount of persons who can gather together, 30. The Czech Republic is restricting movement across its borders. It's instituting a state of emergency. You have the Kingdom of Jordan. King Hussein in Jordan is now having weekend lockdowns. You had Israel that is just coming out of a 3-week lockdown. Nations are seeking the best ways that they can deal with this pandemic while also seeking to keep some sense of livelihood, some sense of viability of its economy and the life of its people.
With efforts underway to reopen the country's tourism sector next month, tourism officials say plans to collect oversight fees from aircraft that will fly through the airspace of the Bahamas are progressing well. Here's Tourism Minister, the Honorable Dionisio de Aguilar.
Once you pull the trigger on how you're going to bill, how it's going to work, there's a 6-month consultation period where you speak to all of the players in the market to advise them of what you're intending to do. So it's a little bit more complex here because even though we own our own airspace, we have managers of that airspace that are not Bahamian. So the Americans manage 75% of our airspace and the Cubans manage 25% of our airspace. And so what was happening was persons were paying the managers directly. So what we're trying to do is say, no, we own it. It's our building. It's our space. You pay us and then we'll deal with them.
The tourism minister says a plan is also in place to address pricing fees.
With a pricing strategy, how to charge people to go over our airspace, into our airspace from an international destination, domestic travel, how to address all of those 3 different types of travel through our airspace, how to price it. And we hired a consulting firm, we got all that straight. Now we're out in the market advising people of our plan and our strategy, and we'll see how it takes us. But certainly in the first quarter of next year, we're hoping to introduce it.
Abaco hoteliers say they are gearing up for the November 1st tourism reopening date. This news as key stakeholders converge to discuss the state of the industry at this year's Abaco Business Outlook. Chiming in via Zoom, the hotel proprietors all spoke on the topic rebuilding Abaco tourism. And after more than 1 year of making repairs to their respective resorts and hotel properties, the panelists say it's time now to focus on the major challenges affecting the industry.
We need to get our home capacity up and running. We need to welcome clubs like Sterling Montage and new efforts to create beds. The airlines will react accordingly with confirmed airlift. But if we don't have a place to house and put people, it'll be slower to evolve. So the quicker we can rebuild and reopen all of our requisite clubs and resorts and private homes. The Abaco's thrives on as private homes as we know it.
The panelists also discussing plans and ideas to help the Abaco industry rebound post-Hurricane Dorian and COVID-19. One of those plans, collaborating with the Ministry of Tourism's airlift team to get more eyes on the island.
We have certainly not done a ongoing and job respect to staying in touch with them and assisting them with that partnership. But however, going forward, we intend to have change that and share more of our viewpoints, and also to share whatever internal data that we have to support whatever initiatives that they may be considering in terms of expanding from new origin cities.
Stay close. We've got more right after this. You're watching The Morning Edition.
During this pandemic, it is our duty to ensure that citizens, residents, and visitors are adhering to the COVID-19 safety protocol. Cleaning and sanitizing will help stop the spread of the COVID-19 virus. Pay special attention to areas that are frequently touched in high traffic by family, friends, and clients. Make sure you're using proper cleaning materials and sanitizers. Place all cleaning materials in the correct disposal or storage area. I'm Ambassador Brittany Johnson of the COVID-19 Enforcement Unit. Save a life that may be your own.
This message brought to you by the Ministry of National Security in conjunction with the Broadcasting Corporation of the Bahamas.
You are a healthcare worker. Thank you for fighting on the front lines against COVID-19. It is normal to feel stressed when taking care of others who don't feel well. But remember to take care of yourself. Don't forget to rest between shifts, eat healthy meals, engage in physical activity, and stay connected to family and friends. Avoid harmful coping strategies like drinking alcohol. For managers of healthcare workers, the same tips apply to you. Here's how you can help. Consistently give updates. Rotate staff between high and low stress level functions. Encourage work breaks and ensure that they know where they can find help. We are here for you.
Everybody, I on TV. Look, I on TV. Mom, guess what it is? That's me. Bartend, do you see me? I on television. I gotta tell my girlfriend I on television.
Hello?
Babe, turn your television to ZNS. Quick, I'm on television.
I don't have a TV in there.
We have Wi-Fi, though.
We have Wi-Fi.
That's fine. They upgrade now. You can watch it live from your phone. You just have to download the app.
All right, hold on.
Go to the App Store, type in ZNS, download the app, and you'll be able to watch ZNS straight from your phone. Hurry up and start over again.
Get your news and more anytime, anywhere with the new ZNS app. Stay connected from around the globe with our live stream news updates, all in the palm of your hand. You can also listen to the ZNS Radio Network for your favorite music. Go into your Apple or Google Play Store and download the ZNS app today.
Present check? Miss I's a star now. I still gotta pay?
As an artist, I travel all over the world and I find inspiration all around me. In the people and especially the environment. I love the Bahamas with all its natural beauty. From Abaco in the north to Inagua in the south and all the wonderful and colorful islands in between. But we must all do our part to keep the Bahamas healthy and clean, now and for the future generations. That's why I want you to find a little time to do your part. I'm doing my part because I care. Do you?
The government is working to ratify promotions for officers from the Bahamas Department of Corrections following similar promotions at the Royal Bahamas Police and Defense Forces. However, a challenge remains according to the Minister of National Security, the Honorable Marvin Dames, who says a commission must first be established as these officers are unique from others in the armed forces.
We have been working very closely with the Office of the Attorney General, who would have had some iteration of how that commission would look and whether it impinges any way on the Constitution, whether we have to go by way of referendum or whether we can just amend the law. And they are considered part of the public service. And so any promotion gets tied into the public service. And that's what from inception has been the problem with the Corrections Department. We as a government said that that's not fair to them. And so we're moving and hopefully very shortly we will correct that.
Dames says adjustments are also being considered to reduce the retirement age for officers across the board.
We've also been working with the Bahamas Department of Corrections as well as the Royal Bahamas Defense Force. I would have tabled in Parliament last year legislation to increase the retirement age because we have been losing a lot of very competent sub-officers within the Bahamas Department of Corrections as well as the Defense Force have been retiring too young because the age was, I believe, 45.
Torrential downpours over the weekend resulting in major flooding on the streets of the capital. Some residents in the Pinewood Gardens area were stuck in their homes due to the elevated levels of flooding, but some still took the risk, even driving on the sidewalks to avoid stalling out. Rather, area member Palman Ruben Raming spoke on the issue.
In many areas of Pinewood, they had up to 18 inches, and in some areas up to 2 feet of water. In particular, the area that is east of Willow Street, and also in particular those areas that are east of Buttonwood. And I know as of Monday morning, a lot of persons will be still locked in and unable to drive out to go to work or to do regular routine because it's just not safe for them to take the average type car and drive through that water. I would encourage the general public that while they go through the Pinewood constituency and any other area that is flooding down, to be very, very considerate towards those persons whose homes are along the roadside, because the wave action of your vehicle could compound things. I mean, just imagine somebody who is trying to dry their house out and you come through and send a wave of water right back into their home. Let's understand that this is a frustrating time, not only due to COVID, but now compounded with the flooding incidents. Let's be all sensitive towards each other.
The Pinewood constituency has over 80 drains, and according to Ramming, most of them have recently been cleaned and water has been handled pretty well. But during this recent downpour, the flooding was compounded by another element.
The flooding was compounded because we also had a spring or a king tide. What that did was restrict the water from being absorbed into the ground. So wells were simply full, and there was simply nowhere for the water to go. I'm just so happy that the rain did not continue throughout Sunday, and hopefully we'll have a sunny day on Monday, and the wells will begin, and the earth will begin absorbing that water so that it can go down within the quickest possible time.
Well, Lloyd Allen in the Morning Edition traffic team is standing by with your Monday morning traffic commute.
Yes, good morning again, LaDon. Good morning, Bahamas. It is the start to your Monday morning, and giving you your first look at traffic. We're coming in from Elizabeth Avenue and Shirley Street. Already we know that roads are wet. There's some intermittent flooding throughout the island. And of course, there have been already a few accidents for the morning. We're going to get to that in a minute. But first, we go to Sergeant Cressenia Johnson from the Royal Bahamas Police Force Traffic Division, giving us an initial look at overnight traffic.
And a pleasant good morning to you, and a pleasant good morning, Bahamas. Over the weekend period, we had a fairly quiet weekend with no accidents being reported to the Royal Bahamas Police Force Traffic Division. However, just for this morning, we've had a traffic accident on East Street and Soldier Road, Rosetta Street, and near the old supermarket, East Street and Soldier Road. East Street and Robinson Road, just north of that Robinson Road intersection, Blue Hill and Soldier Road. At this time, there still remains 9 persons who are hospitalized as a result of being involved in a traffic accident.
So, of course, we had some other things to talk about this morning, but that takes precedence. Yes. Of course, what advice? Of course, we can tell drivers drive slow. I know last week and a few weeks ago, we started talking about the importance of changing your tires on time, checking your brakes. These little things make the difference in conditions like this.
Yes, the main thing that we want to focus on when you're riding on with wet road conditions is you want to decrease your speed, of course, because you want to drive for the road condition that you're dealing with. And based on the road conditions, like I said, if your tires are not intact, you're going to be sliding on the street, and you're making those sudden moves. The tires and the vehicles usually lock up and ending up in a glide, and you're crashing into somebody's vehicle. Another thing we want to just remind persons of, as it pertains to traveling in lines of traffic, if you are driving, you want to maintain that distance, that braking distance between you and the vehicle that is ahead of you. So say, for example, if there's someone behind you that's not paying attention to that, they hit your vehicle would not basically extend to the vehicle that is in front of you because you're maintaining that distance. So remember now, when you're driving on the street, to maintain your distance as well as watch your speed. Another thing that we're seeing, we talked about it some months back, the persons with malfunctioning windshield wipers. And what happens to these malfunctioning windshield wipers? Persons tend to just lean outside of their vehicles and wipe it off. This is something we want to discourage. If your vehicle is in that condition, you have a defective vehicle. You cannot utilize that vehicle while on the street. Your vehicle is for basically dry weather conditions, and even so, it's still defective, so you will be ticketed if you see that. You're advising as much as possible for you to have that situation rectified. Okay, so as long as we have these conditions, as much as possible, just advising the general public to please utilize the streets with added care and caution.
Now, that's some great information. Of course, we will continue to follow this weather as it develops, and conditions across the country, as we said, are a bit sketchy, so you definitely want to drive with caution and care as you make your way to your various destinations. Reporting for the morning traffic team, Lloyd Allen, ZNS Network News.
Several instructors at the Bahamas Technical and Vocational Institute are seeking to become unionized pretty soon. According to President of the Union of Tertiary Educators of the Bahamas, or UTEB, Daniel Thompson, earlier this year, faculty of BTVI applied to the Ministry of Education, Jeffrey Lloyd, for the determination and recognition of UTEB as their bargaining agent. Thompson says faculty at that technical institution are concerned about their working and employment conditions in this very crucial time. However, the UTEB president says later revealed that those concerns must be addressed to improve productivity in the workplace.
Some heads of departments are required to report to 2 different deans, which blurs the lines of communication. Training for teachers in the online environment is inadequate. Despite the hours dedicated to training, the entire exercise was poorly executed. Teachers in the trade areas especially have suffered as many were taken off the teaching schedule and classes canceled. Canceled classes affect student timely matriculation. Returning students also need training in the online virtual environment. Many of them are uncomfortable with the platform. They are withdrawing from classes because they are not equipped to do an online class, and many lack infrastructural connectivity and computer support at home.
While a response from the minister is still pending due to the impact of COVID-19, Thompson says he remains hopeful that better days for BTVI staff will come sooner rather than later.
We are very confident because currently we have almost 24 members of the instructional staff have already expressed interest and have become a part of UTEB. So we are confident that though the authorities may attempt to delay the process, that eventually we will be victorious. And may I add that not only are the instructional faculty concerned about unionization, but so are the line staff. They also wish to unionize as well, but we will deal with that at another time.
ZNS News reached out to the president of BTVI, but he refused to comment on the matter. Meantime, Director of Education Marcellus Taylor says the Ministry of Education's learning management system is back up and running. This after technical glitches with its virtual system earlier sometime last week.
We are reasonable and we are realistic to know that there will be some challenges from time to time. We also know that we will have challenges in terms of user error. And this is why our efforts to train teachers and to train students are ongoing and persistent. If you go on our website, for instance, you will see videos that are there for students that assist them with things like logging on and so on, so that they could get comfortable with the system and be able to navigate it properly. We've also established support lines for people to call in if they need guidance as to how to navigate the LMS.
Additionally, Taylor says that the newly implemented system is a vital teaching tool that assists in bridging the gap between the Ministry of Education and school officials.
We are looking forward to using this, the EMIS, not only because it will continue to make the management of the daily operations of schools a lot easier for school administrators. Right now, if we want information, or prior to right now, if we wanted information on what is happening in schools, we would have to call around to each school. They would have to manually go and collect the information and then collate it and then send it to the ministry. Sometimes, for something that you may think is quite simple for us to get, it might take days because administrators are engaged in their daily activities. And when we have to call them to get that bit of information, it pulls them away, or they have to juggle it between doing other things, and it's a lot longer process.
2 Bahamian college students are asking for your support as they participate in a startup business competition for students. Here's Catherine Gomez.
College students Shanika Ferguson and Fredisha Neely are surely making our nation proud as they were chosen out of thousands at their school, East Central University, to compete in the Collegiate Entrepreneurs Organization Global Pitch Competition. Students all over the world will gather on a virtual platform, showing their business model in hopes of winning a $7,000 prize. Janika and Fredicia's business model is called We Care & Co., which plans to help students in quarantine by providing them with care packages such as medicine and other items to help them physically and emotionally during these hard times. Senior Janika says she's elated to represent her school and the Bahamas.
It feels amazing to represent my university and the Bahamas because I think that the Bahamas is academically excelling in the world, and we just need a lot more platforms to just broadcast and show our talents. So I am very proud to be able to be a Bahamian and showcasing that we do have entrepreneurs back home and that we do have academically and great people that can form their own business, win these competitions, and just excel overall.
Senior business management major Fredicia says she hopes to represent the Bahamas well and implores Bahamians to follow their business dreams.
Right now, more so than ever, it is the time of the entrepreneur. It is the time of the female entrepreneur. It does not matter your circumstance, where you come from. Everyone has potential and everyone has the ability to succeed. I just hope that we get much love and support from our Bahamian people as we journey through this competition.
Janika and Fredicia says any support from the Bahamian community would be greatly appreciated, as part of the competition will be judged by social media likes and views on their 90-second pitch video, which will be posted on the People's Choice Awards for Collegiate Entrepreneurs Organization 2020 YouTube page.
Within this competition, it is kind of social media based and having a social media campaign as well. So I would just suggest all of the Bahamians to, just go on the CEO page in the YouTube playlist and like our pitch videos, as well as comment, let us know that you're there and that you're, watching the videos, because that means a lot to us, as well as it can help us win the competition. Simply liking, commenting, and sharing it around, the entire country will help, because there's always going to be a chance that we can win that large amount of capital to fund our businesses, which we are very passionate about.
Janika and Fredicia say they plan to do their best during this competition, as they hope to inspire others to chase their dreams. Catherine Gomez, ZNS Network News.
Thanks a lot, Catherine. Stay close. We've got more right after this. You're watching The Morning Edition.
The Dixon Hill Lighthouse on San Salvador to let you know that marine protected areas make dollars and cents. A well-designed and managed network of protected areas can generate income for nearby communities. From MPA managers to lodges to eco-tours, there is money to be made.
Healthy marine ecosystems help to protect our islands from climate change and other impacts that we cannot control. Healthy coral reefs help to break down fake waves, and mangroves absorb storm surge and help to protect our coastline.
Older and larger fish tend to carry more and healthier eggs than younger fish. Fish replenishment areas will allow fish to grow bigger and ensure that we have more fish now and in the future.
In our replenishment area, fish are free to grow and reproduce. As their populations increase, more fish will spill over into other areas where fishermen can increase their catch and their income.
I support the establishment of a marine protected area on my island.
I support the establishment of marine protected areas on my island.
I support the establishment of marine protected areas on my island.
I support the establishment of a marine protected area on my island, and you should too.
And you should too.
And you should too.
And you should too.
See the future with Bahamas Protected.
Local farmers are engaged in an online educational initiative expected to yield mass production of fruits and vegetables annually. Here's Carla Palmer.
Fresh fruits and vegetables is what Linlow says she lives for. As she eagerly makes her selection at Sinclair's farm, she tells ZNS News she could never get enough.
Like, I started my organic farm 2 years ago, and it's, you know, it was wonderful to just go back and cut your leafy greens, and there's certain things that grow really well in the season from, you know, November to May, basically. And, well, they go all year round, but you can get more leafy greens from them in the season. Or if you want to live longer, I mean, if you want to die young, eat whatever you want.
For those in it locally, farming, while time-consuming, is profitable. Karen Shepard would tell you so, having been in the business for more than 15 years. Now serving as president of the Bahamas Agro Entrepreneur Cooperative, Shepard is leading her 200-strong industry members to another level in the sector.
In conjunction with His Excellency Ambassador Dr. Andre Thomas, we have liaised with the Israeli group so that the farmers have an opportunity to do online courses. And so they have offered us free of charge courses for our farmers, which is taking us into precision agriculture, meaning that we will move from the unsustainable way of doing farming to a more productive and industrial way of producing more crops.
New technologies in farming, soil preparation, food to market, and livestock are some of the topics to be addressed in the online course. Sustainability in mass crop production is the overall objective.
I do regard this as a first step towards us galvanizing the agriculture industry, one industry in which all Bahamians should actually own. At this point, in the year 2020, we should be much further ahead in agriculture. And I feel as though with this course, it's a stepping stone to allow the farmers to be able to move to another level, and also for them to be able to utilize that information in this growing season to be able to produce more crops.
So far, 100 farmers have signed up for the online course, which will take place over the next 4 consecutive Wednesdays, beginning next week on October 21st and ending November 11th. Carla Palmer, ZNS Network News.
Thanks, Carla. Well, hard work pays off. That's the key feature for our next Marine Profile. This morning, we meet an officer who is a triple threat: disciplined, multi-talented, and committed to excellence. Lloyd Allen takes us to the parade grounds at the Royal Bahamas Defense Forces Coral Harbor Base.
My unspoken mantra to myself is faith, consistency, and hard work. There's nothing in this life that we can't accomplish with a little bit of hard work.
Able Seaman Troy Seymour says while hard work is a part of his daily routine, making it a habit was a process he started a decade ago while in high school.
I wasn't a troubled child, but I had some struggles due to my my father's passing. And I kind of started to flunk in school, not really give too much care in the world about stuff. And it wasn't until I joined the Royal Bahamas Defense Force Ranger program that I started to refine myself.
That reinforcement eventually led to his enlistment on the RBDF, and like they say, the rest is history. A diverse officer on the road to building his career and family, Seymour is proudly one of few selected to represent the country in honoring the national icon, Sir Sidney Poitier.
It's a real sweet moment to
leg raise push-ups.
Be a part of a historic moment for one of our country's heroes. We adorned the Sir Sidney Poitier Bridge that connects over to Paradise Island in an immaculate parade with over 100 Marines lining the streets, as well as the band leading in a song.
To Sir With Love is from the 1967 British drama under the same title. A drill master and musician, Seymour lauds discipline as the most important skill for Marines. And after working with a few recruits, he even taught me a few military drills.
And so when the command is given, unit, stand easy. Your hands will release from the rear. They will come out to your sides, palms facing to the rear, for a pause of 2 seconds. Unit, stand at ease. Unit, halt.
It seemed as if I was getting the hang of it until Seymour decided to throw me for a loop. His attempt at breaking the civilian mind in me, well, it worked.
Snap to it, you. You better keep me upset.
And that's been a look with my officer, Seymour. It's been rough. Lloyd Allen, ZNS Network. Woo, news.
Well, it's a signature event theater lovers look forward to every year. Since the closure of theaters due to the COVID-19 pandemic, there was no way to produce Shakespeare in Paradise, a theatrical series which incorporates a number of community members and partners for the production. Chairman of the Dundas Theater and artistic director of Shakespeare in Paradise is Philip Burrows.
It's very little that we can do. I hope that if these lockdowns continue and we're not able to open in a regular sort of way, that we will be able to do an alternate kind of thing, like the outdoor space where we can properly social distance and we can have people perform. The actors are ready. They're chomping at the bit. So, it's just something that we just need to get stuff done. That's really the thing. I mean, we just need to move forward.
Don't go anywhere. The Morning Edition is back right after this.
Our marine resources were once considered inexhaustible. Conch and reef fish like grouper were abundant everywhere, and it seemed as if the lobster catch would rise forever. But today, there is a downward trend that affects everyone. Researchers say we can reverse the trend by protecting more marine habitats. And the good news is that most Bahamians strongly support efforts to halt further decline. Tripling the size of our network of marine parks will mean more fish and conch for everyone, now and for the future, as well as more recreational and ecotourism opportunities. Today, only 10% of our waters are protected. Surveys show that most Bahamians consider protection of our marine environment to be a top national priority. More protection means more benefits for everyone, now and in the future. It's a win-win-win strategy for the economy, for Bahamians, and for nature. Protect our sea, protect our way of life, protect the Bahamas. See the future. Visit Bahamas Protected on Facebook to learn more about marine protected areas.
A local healthcare facility is offering Breast Cancer Month specials for an extended period this year due to time restrictions brought on by the COVID-19 pandemic. Crystal Darling finds out more about the signs and symptoms and what can be done to catch it early.
For breast cancer in the Bahamas, we have to try and get people to actually go for their screening.
It is recommended that women over the age of 30 go either annually or biannually to get their breasts examined. Founder of Fourth Terrace Diagnostic Center, Dr. Elizabeth Darville, says that the alarmingly high rate of breast cancer in the country is because the BRCA or breast cancer gene is common in Bahamian families. This year, her office is providing discounted screenings for Breast Cancer Month this October and also in November.
Tests are expensive. But therefore, if you have people in your family who have breast cancer, then you need to pay attention. You need to have your mammograms and your ultrasounds done regularly because you know already that your mommy has or your sister has or your auntie has breast cancer. The thing about breast cancer, any cancer for that matter, is catching it early.
She stresses the importance of screening, saying that by the time an individual may feel a lump, it would have usually already developed into a greater stage.
The problem is that the first sign of breast cancer may be a lump, maybe a nipple discharge. By the time you feel the lump, you may have stage 2 or 3 cancer. So the way to prevent that is to actually have your mammogram and have your ultrasounds and catch it early. Early means before it is possible to feel a lump.
Darville says making a schedule and sticking to it is crucial. If there's a family history, screening should be done annually. If not, they can be done biannually. She recommends planning it out with your doctor.
If we caught all the cancer cases at stage 1 early, before it was a lump, when it can be removed and treated and forget about it, then the consequences of having that cancer goes down. People who are stage 3 and stage 4, now you're not thinking of cure anymore. You're thinking of how long can this person survive without recurrent disease.
She says that early detection can remove the cancer completely.
So if everybody gets their screening done, gets their mammograms and breast ultrasounds done, then the consequences are lessened.
Crystal Darling, ZNS Network News.
A local insurance company now rebranding its efforts to better serve the needs of its clients in the region. Colonial, Atlantic Medical, Security and General, and the national insurance brokers and agents now unifying under CG Atlantic. A brief ceremony took place to celebrate the milestone.
All now have a common branding, common logo, common names. It's a very, very important milestone in the evolution of our company. In the Bahamas, the pensions division went under the name Colonial Pension Services, Colonial being the former name of the parent company and the parent entities. Today, that has all changed. Throughout the entire region, we will now be named Coral Isle. So the name Colonial disappears and it's replaced by Coral Isle, which has greater significance for our business. Our core markets where we have a physical presence, Bermuda, Cayman, Bahamas, BVI, Turks and Caicos, all have a common geographical makeup. These are the Coral Islands in the Caribbean and the Northern Caribbean.
There will be no significant changes to the company's portfolio. However, clients will continue to have access to diverse financial service offerings, including motor, property, and medical insurance.
The significance of the name change is that we all are coming together as one company, one group, and being identified as a part of the same group throughout the Caribbean. One name, one company, all together. It is good because many times we had to explain that our sister companies with a different name made them sound like stepsisters, and we always had to explain why they had a different name. So this makes it so much easier for us.
Roughly 1/3 of the local population is at risk for developing hypertension, and that can lead to a number of other health complications. Crystal Darling explains. Stay close, we've got more right after this. You're watching The Morning Edition.
Hi, I'm Dr. Pinder. During this global pandemic, we ask for you to be responsible. As we fight the COVID-19 virus together, we would like to encourage you to do the following. Wash your hands. Cover your mouth and nose with a flex elbow or tissue when coughing and sneezing. Practice social distancing by staying 6 feet apart. Avoid touching your eyes, nose, and mouth, and if you must go out, wear a mask. We stay here for you. Please stay home for us. To those of you on the front line, we salute you as we continue this fight together.
This message has been brought to you by the Ministry of Health in conjunction with GD Media Solutions and this television station.
ZNS is everywhere you are when you download the new ZNS app. Watch our live channel to keep up with what's going on in the nation. News updates, we've got you covered. Tune into our radio stations with just a swipe. On the road, on the go, we're here with you. Available for download on the App Store and the Google Play Store.
It is important to take precautions to reduce your risk of getting infected with COVID-19, even when you go to the grocery store. Practice physical distancing that is 6 feet apart from others while you wait in line to enter the store. 1 person per household needs to go. Use wipes to disinfect the cart or basket handle that you select. Avoid touching your face, unnecessary items, and surfaces. Try to touch only what you are buying. So carry a grocery list to help you move along quickly. Do not forget to wear a cloth mask while you do your shopping and carry hand sanitizer with you. Practice physical distancing that is 6 feet apart from others as you shop and at the cash register. Spend as little time as possible in the store and get enough groceries to last you for a while. Once your groceries are packed and loaded, use hand sanitizer and rub your hands together until they are completely dry. When you come home from the grocery store, take off your shoes at the door and put all of your grocery bags in one area. Disinfect your grocery bags. Rinse produce and wipe down cans and packages with soap and water before you put them away. Wash your hands thoroughly for 20 seconds when you are done. Wash your clothes and your reusable grocery bags.
This message has been brought to you by the Ministry of Health in conjunction with the Broadcasting Corporation of the Bahamas.
During this pandemic, it's our duty to ensure that all citizens, residents, and visitors are adhering to the COVID-19 safety protocol. Every person shall practice physical distance between themselves and others who are not of the same household of no less than 6 feet. I am Ambassador Amanda Edgecombe of the COVID-19 Enforcement Unit. Save a life that may be your own.
This message brought to you by the Ministry of National Security in conjunction with the Broadcasting Corporation of the Bahamas.
By giving unconditionally, not expecting anything in return, I thought was a wonderful way of showing this love, and I believe that it is love that truly draws people, and so I thought we could cover a lot more people by feeding. Volunteers, you know, they have truly been sold.
My passion is to help, and I thank God for what I can do through the help of Bahamas Feeding Network.
What about me?
What about you? What?
Well, I thirsty too, you know.
You want to see all the water out there?
Well, why you don't give me your water and then you go try and drink that salt water?
You crazy, eh?
I ain't the one talking to a dog, you know.
Ain't nobody can drink salt water.
Then why you won't give it to me? All dogs need fresh, cool water and sufficient shelter from the sun all year round, especially on the beach and during the hot summer months.
Summers are very hot here in the Bahamas, so please make sure all pets have ample, cool, fresh water in proper containers and sufficient shelter from the sun, even on the beach. And make sure all dog houses and kennels have proper ventilation. Let's make it Bahamian to be humane.
This message has been brought to you by the Bahamas Humane Society and the Broadcasting Corporation of the Bahamas.
And here's a quick look at this morning's weather forecast. And that's a wrap for us this morning. For the entire team, I'm LaDawn Davis. Make it a fantastic day, everyone.